I, Let me just kind of run you through my alphabet soup. I am a doctor of chiropractic. I'm a diplomate with the American Clinical Board of Nutrition, and I am also a certified nutrition specialist and a licensed dietitian. And I have been at NUNM since 2018. I was in clinical practice for 23 years, but I've been in healthcare for 30 years. And I the pandemic was kind of my moment to retire, and I've been teaching at NUNM full time since 2018, and I am an associate professor here in the both the bachelor's degree and the master's degree program. And I do mostly clinical work, but I also just one of the things that I've been really passionate about, and that's important to me, is uh, food security and food sovereignty. And so I teach also a lot of classes like global and ecological food issues, food security class in the bachelor's degree program, along with American food systems and community foundations of community nutrition. So those are the things that I teach also in the bachelor's degree program that I'm very interested in. And one of the reasons is because I grew up food insecure myself throughout moments in my life when I was younger and in a very rural area. So we had to grow a lot of our own food just to basically feed ourselves. And so there were some really lean times. And so I grew up also in an indigenous community. So it was very important also to me to honor a person's culture because of that experience that I had. It was Native American Pomo Indian tribes. And also the other things that are important to me is I grew up in a rural area around a lake that was very contaminated, especially through the 50s and 60s with DDT. So I'm very interested also in the environmental impacts because not only was the indigenous community impacted by that, but myself and my family. My sister was diagnosed with Parkinson's disease in her 40s. And so these are things that are, I think, for all of you that bring us to our vocation. And so whether it's our own nutrition experience, whether it's a disease process in ourselves or our family, or experiences growing up, whether it's farming or food security, et cetera, those are things that are kind of bring us to this interest point and wanting to help others also to be of service because of those experiences. Also, as a student, I experienced a lot of food insecurity. And so I was on food stamps and SNAP benefits just to help me get through because I didn't realize how much my books cost, right? So I also did work study at the same time. I worked in the library and I was a research assistant doing work doing that. So those are things that we're very passionate here about is looking at food as culture, food as nutrition, and looking at the philosophy of nutrition. And then in the master's degree program, I'm just going to segue. I do a lot of clinical work because of my clinical background as a chiropractor. I always practice clinical nutrition. And that was because also a lot of my patients tended to gravitate towards prescription medications. And I got very concerned about that because I was always a natural medicine practitioner. And I knew that food could become medicine. And that was always my philosophy. And I found that NUNM aligned with my philosophy. So with that said, that brought me here. And I always looked at NUNM. One of the reasons also as a place to teach and a place to kind of give back, I want to be able to pass the torch back to students of what I learned. But that philosophy of food as medicine and natural medicine was always something that was close to my heart. So I'm happy to be here. You'll find many of the instructors also in this program are very passionate about food as medicine and natural medicine. So I think if that's kind of your vibe, you're in the right place to come here. So um, I was tasked to talk about some of the clinical portions of this program. So I wanted to present those things to you, and primarily the certified nutrition specialist's credential is what I'm going to be discussing. And I don't know if um, any of you know about the CNS and what that entails. Sorry, my phone is going off here. What the CNS entails or have interest in that. Does anybody have any ideas about the CNS, or is that a reason what brought you here? Any of those questions? I want you to just jump in, and even if you just go off your mute button.
And then I'm keeping an eye on the chat too.
Okay, great.
Yeah.
Yeah.
I know I hadn't heard of it until I started working at NUNM. I didn't know that was possible. I'd always heard of registered dietitians, of course, but
Yeah.
and when I did start working with one when I was in college, coming back from living in Mexico, and my gut microbiome was all kinds of confused, right? I
Yeah.
was frustrated that they had to stick with something really strict, and like my food allergies weren't taken into account very well. So coming to NUNM and learning about the CNS and hearing about a different path was really exciting, like for me personally, to be able to work with someone else that might be able to take those food allergies into better consideration. Does that make sense?
Yeah, thank you for that. That's really important because that just actually helps me kind of set this up, because CNS and registered dietitians are actually um, kind of synonymous. RDs have been more recognized, and but CNSs are actually creating a national footprint where we're either equal or actually above RDs. And the reason why we're above is because we've always required an advanced degree, a graduate degree, a master's. And they just started requiring a master's degree at the beginning of January. So a lot of students have questions about, well, what will that get me as far as a job, right? Because really that's why you're coming back to school if you're transitioning from another job, or you want to kind of up your education, is how can I really position myself out there in the workforce to make money, to have a business, and also to help the public, right? To heal and to have better nutrition and or reduce disease risk. So the CNS, what's really beautiful about that is now we are starting to become recognized on a state to state level along with RDs. And we're also getting our licensure along with RDs. And so it's usually a license in dietitian or licensed dietitian nutritionist. So you'll really see that. And so don't be afraid of the word dietitian, because dietetics is taught in most nutrition programs, and it's also taught here. So it's not this bad word, and it's not this really, clinical word. It's the things that we teach you of how to perform dietetics out there in the world. So I just wanted to plant that in your head a little bit. And the reason why we also are promoting, or we use the CNS as kind of a segue or as an extra credential, is because we are recognized in other states and we are able to get our license. So that way we can also bill insurance companies. So that way you can make more money. You can also bill what we call medical nutrition therapy. And so that helps when you get out there and you want to practice clinical nutrition. This credential will help you be that in that position to be at a greater level. And it's more of an advanced personalized nutrition. So I'm going to share my screen with you, and I'm going to take you through some of the kind of nuances or details of the CNS. Does anybody have any questions before I head in that direction?
We do have a question in the chat.
Kayla. Okay. I'm just learning about the pause on CNS licensure here in Oregon. Well, thank you, because I am also, I was appointed to the board of licensed dietitian in Oregon by the governor. And yes, we are currently having a little hiccup here in Oregon. And there's about 10 or 12 of us who are actually licensed CNSs with our LD here in Oregon. And we're currently we are sort of working against the tide, and they have not modernized their health licensing office. And so we have just sent out letters and showing how we are credentialed and how we are advanced degree professionals, and that the CDR exam, which is the exam for RDs, and the CNS exam actually are equal, or actually CNS is a little bit above as far as rigor. And so we're having to send them all that information right now. And so, and then also about our supervised practice hours, you have to have it also at least 1,000 supervised practice hours for the CNS, but the RD for the licensure for RDs in Oregon is only 900. So actually we have 100 more hours of training under our belts too. So, and we're currently we have sent letters to our representatives, our legislators, and they are actually in contact with the Oregon Health Authority. And so we're working on that level to try to change some rules. We can't change the statutes right now, but we can change rules and they can make exceptions. So they're either going to accept us because we've been licensed for over 2 years now, or they're going to revoke our license. So we're not sure what's going to happen with that. So we'll keep you updated. And this is the battle that we're trying to work for advocacy, which I'll talk about in the slides that I present. So I'm going to go ahead and put those up. So great question. Thank you. Any other questions quickly?
Did have one. What is the benefit of CNS over BCNS?
BCHS.
BCHS, yes. And there was a correction in the chat right there.
BCHS is not recognized like the CNS is, the BCNS. Okay, so they are not advocating on a state level, and they're not as recognized, so they are not getting their licensure like we are for CNSs. Okay, let me do a share here. Share. Can you see my screen? The CNS pathway, my slides?
We can, but it is not in presenter mode. We still have the slides on the side.
Oh yeah, yeah. I'll get there. I just want to make sure you saw my slides first.
Yeah, we do.
Okay, great.
Thank you.
So this was just recently done by Amy Smith, and she is the, I'll just take you back. She is the Senior Director of Certification and Advocacy. Usually I do my own slides, but I had her come at the end of October and do this. So I'm going to present some of her information because it's updated. And so I'm going to take you through this. We'll look at the overview, the benefits, the pathway, and I'll talk a little bit about advocacy. One of the other reasons why I really like the American Nutrition Association and the CNS is it takes a more holistic approach, meaning that we're working in a clinical setting and we're not just prescribing or working in the food industry. We're basically out there working one-on-one with other doctors. And so that's what I like about this particular credential. And I like their philosophy also. Now, the American Nutrition Association, under this umbrella, is the Board of Certified Nutrition Specialists. And what does that mean? That just means that they're the ones who kind of oversee the exam, the education, and the supervised practice experience. And then the Accreditation Council is for nutrition professional education. This is for master's degree programs. We're currently continuing, or we're just kind of right in the middle of becoming accredited also. So, and what does that mean? That just means that it's easier for us to get our licensure and our credential. It just means that we're kind of a little bit above, and that we're really paying attention to this advanced personalized nutrition credential. So the key is for education, basically for the ANA, these are the pillars. They have a lot of CE content on their website. They have a membership program, and they do a lot of trainings along with different symposiums and different webinars and things like that. They have different certifications. The CNS is the most recognized. They also have other ones that I won't talk about. You can go to their website. And then basically, they advocate, they've been really good working with us, uh, with the Oregon legislature. They've been to our board meetings with us. So they really are very proactive. They provide a little bit of legal support for the advocacy also. And then for connecting, this is a nice way to connect with other CNSs also. And they have a lot of support and a lot of membership and a lot of networking events that they do. So it's a nice way to do that. And they do offer some student pricing, which is really inexpensive, $20. They offer a lot of handouts on different diseases, conditions, again, continuing education, some nice libraries, and a great journal that they have where professionals can submit to that. So let's get to, I know that went really fast, but I just want to get to the kind of the experience. And uh, the really important thing is the 3 E's on this here is what's the education requirement, what's the supervised practice experience requirement, and then what's the examination requirement. So I really want to go through that. And they are accredited by the NCCA also, which is the same as the RD program. They are also accredited by NCCA. So we're, very equal as far as that's concerned. And the benefits of accreditation, again, it gives us credibility, and especially with state and federal professional organizations. And then it gives us also some really good third-party verification. And then they have great, I was also on the item writing committee for the examination, and I can tell you how robust it is in comparison also with the CDR exam. So it's quite intense also. So what are the career paths for CNSs? Again, you can go into private practice. Many go into integrative clinics with chiropractors or NDs, or even work with other RDs. And some like to do some writing or do blogging or podcasting. And many of our students actually have gone into teaching or academia. Many are teaching on the university level. Many come back to our program and teach, or some go to community colleges and teach nutrition there. Many also work for nonprofit organizations or even some licensing boards or public health. Also, we have many of our students go into public health in different counties. So that's also another avenue. And then research, many of our students work up at OHSU doing research. And also some students have gone on to work for supplement companies and working and doing biochemistry. I'm just going to move this over. I think it's in the way. And then community nutrition and culinary nutrition and some group and community programs is really important also. Whether you're working with farms or doing community nutrition, again, in public health. Or just doing some education programs where you might be working different community centers or different neighborhoods, things like that. So there's a lot out there for CNSs and for advanced degree nutritionists. So let's talk about the 3 E's: education, exam, and experience. You do need to have your master's degree, and there is a certain amount of coursework. There's about 36 semester units of coursework that is required. And the exam is 200 multiple choice questions, and it's about 4 hours long. They offer it typically in December and in June. And usually you have to have your application in by October or by April, depending on when you want to take it. The supervised practice hour experience is 1,000 hours, and this is divided into two separate sections: direct care, which is 750 hours, and then or observational, which is 250. Now you can do all of it as direct, which is direct patient care. It's just optional also to have that observational. and you have to work with a approved supervisor by the BCNS. So usually a supervisor applies, or we have supervisors also who work in our faculty here. And we also have a postgraduate internship program that offers you some of your CNS hours, both direct and indirect, depending if you want to work doing our clinic rotation or doing our postgraduate internship program after you graduate, or you can work with me in the virtual clinic for mostly online students. And it's interesting because that's a really important class because you're going to gain a lot of confidence. You're going to do some peer-to-peer work, or you're going to work with some standardized patients, and it'll really help you work through some clinical cases. And most of those clinical cases have been my cases from my own personal private practice. So we already kind of took you through some of the um, different information. Also, not only a master's degree, but for me, I had my doctoral degree. Then I went back and got my master's. So a lot of DCs or NDs will also go back, or a lot of nurses, or there's also some nutritionists who will get their doctor of clinical nutrition and will also come back and get their CNS. And the coursework has to be from the United States and 36 semester credit hours. Now, what we have to do, or what we had to do, is we had to take our own personal coursework credits because we're on a quarterly system. We had to convert them into semester credits. So that's why you're going to see this 1.33 divided up. But this is an example of our coursework requirements. For nutrition, it's 12 credits, and you can see all the different courses that will be applicable to meet that requirement. And here are the credits, and it has to be at least 12 credits. Now you're going to see not exactly, this won't exactly equal 12 credits. So just to let you know, it might be over or a little bit under, but it's just, these are samples. And then for our requirement for biochemistry is 6 credits. And I teach all of the most of the biochemistry classes also, 4 different ones, and nutritional biochemistry, clinical biochemistry and nutrition, and advanced nutritional biochemistry, and then the biochemistry for life science classes. But also Dr. Erlandson's fundamentals of nutrition also accounts for a little bit of that. But we went ahead and got these biochemistry classes also set up to count towards your 6 credits. And whenever I got here, that didn't happen. So we wanted to make sure that those all counted. And then for coursework in anatomy and physiology, this is important. Many students I find don't have their anatomy and physiology. So you can either do that before you come, or you can do it while you're here. Some students do it after they graduate, but make sure you have your anatomy and physiology. That's the only one that you're not going to see directly in the master's degree program. You either have to do it before, during, or after. And then 12 credits are required for clinical and life sciences. And you can see these are the different credits also that align with the requirement. And then 3 credits for behavioral science. This could be graduate or undergraduate. So if you have something that you're bringing forward, then just know that it will count typically. Any questions about those requirements?
We don't have a question necessarily about requirements, but we do have one in the chat, which is, are there any licensure titles we can apply in Oregon for after graduating?
Say that again.
Are there any licensure titles we can apply in Oregon for after graduating?
Other ones that you can apply for, other certifications or licensure titles. Licensure titles, no, but there are other certifications. There's one in mental health and nutrition, and that also is 1,000 hours. So it depends on where you want to go. The DCN is not a you're not licensure. There's no licensing board for the doctor of clinical nutrition. I think eventually they might make one, but that's probably far off in the future. Uh, Other licensures that there's no others that I can think of at this time. But if I think of something as we go, I'll let you know. Yeah. Okay. So when you get ready and you've passed all your coursework and you've gained your supervised practice hours, you don't need all your supervised practice hours to take the exam. You can take the exam before you complete your supervised practice hours. And that's the same for the RD also. They allow that um, for you to take the exam before you meet all of your supervised practice hours, but you won't get your certificate or your certification or credential until you pass the rigorous exam. And so you have to download your or upload your coursework form into the candidate portal. So I would recommend you signing up for the candidate portal. You don't need to be a member of the ANA, and this is all on the American Nutrition website. You don't need to be a member to sign up for a candidate portal, but you can start getting information about the exam and about the requirements, and then you can start uploading things as you complete them. You also need to send your officials transcripts, 2 letters of recommendations, and a resume, and all of it gets uploaded to the candidate portal in the ANA website. And then the fees are listed here. The application fee is $100, $400 for the exam, and an $83 fee to a test center. And then if you have to retake the exam, I think it's also $100 to retake the exam if you don't pass it the first time. And you can take it as many as you need to uh, before you pass it. The 1,000 hours are set up in different categories, and there's category A, B, and C listed here. And in each category, this is for supervised practice experience, you must have at least 200 hours minimum in the assessment and interpretation. So nutrition assessment and interpretation is like doing your anthropometrics, all of your subjective and objective data that you do on intake when a patient comes into the clinic. And then you do all of your uh, body comp and all of your BMI and your assessment and getting ready to do your dietary analysis. That is what's considered your assessment piece. And then interpretation is considered doing a diagnosis based on that subjective and objective information that you've collected. And then in category B, then what you do is you create a personalized nutrition intervention or a personalized nutrition plan, and you're able to evaluate and monitor if that plan's working for that individual. And so that comes also with some education, counseling, and ongoing care. And then category C is monitoring and evaluation, making sure that your patient is meeting some outcome markers, that you're always following up with them, and making sure that they are meeting certain goals, whether they're your goals or the patient's goals. And then you're continuing also if they've gotten better or if they've improved, then you can work on the next problem or issue, and then you do a new evaluation and treatment. Also, you can count your time with your supervisor. As a supervisor, we meet like once a month, typically, sometimes sooner, maybe once every 2 weeks in the beginning until you used to uh, uh, do all your documentation, talk about cases, do grand rounds, and and then you need to do your candidate report and track all your hours on a big spreadsheet um, that the BCNS provides for you. So you have to be really detailed and make sure you're diligent about keeping track of all your hours and who you're working with and what you're working on. And so the goal with that spreadsheet also is all the competencies on it are, you want to make sure you meet those competencies and that'll help you meet your career goals. And also, it meets state licensure. And once you have graduated from the program, then you can complete your supervised practice hours up to 5 years after you pass the exam. And then there's different supervisions. You can either do supervision through us for a little bit of the time, and or you can find a mentor out in the workforce who will apply to become your supervisor. So that's another way that you can do your supervised practice experience. Also, the ANA has a list of supervisors for each state. As I stated earlier, there's a minimum of 750 hours, and this is direct contact with a client. And so basically, you're preparing and you're working with them. And this means even preparation work by doing their personalized nutrition plan or whatever education piece. And so this includes counseling and working with groups too. So if you're doing community nutrition, you can also count it as direct client hours. Even the research, and you need to make sure that you're charting everything in your either your nutrition focused chart note, which is called ADIME, and that's for assessment, monitoring, and basically evaluation, or a SOAP note. Let's see. Other indirect experience is just listening to videos, shadowing experience. You go out into the field, you shadow a clinician. You're not really active in the care of the patient, and you might participate in some simulated exercises or do some role playing and or some case studies. So those are considered indirect hours, and that can be up to 250 hours. Again, you can do all your 1,000 hours as direct if you want to. This is just another optional. A lot of times you'll get your indirect experience through us, especially in your last year here. You'll do a capstone project, or where you'll work either in the virtual clinic or you work in the uh, clinic here on campus, or you can go out and do a direct experience out in the field. The following activities do not qualify as supervised practice experience, and this is research not related to a current client, writing books or blogs, teaching a class in academic programs, developing condition-based training programs, presenting educational lectures, or watching educational lectures. And then this takes you through each category of the assessment piece. And so you can, I'll make sure that Nicole gets these slides and you can basically go through this. But we're basically looking at qualitative and quantitative data that we're collecting. And this tells us about our client. And basically, we're looking at also laboratory markers, personal and family history, nutrition related history, uh, and their behavior, social lifestyle also. So we're just basically documenting all that information. And then category B, this is your intervention. This has to do with what type of food and medicine prescription plan are you going to provide your client based on their disease that they show up with or whatever their diagnosis is. And how are you going to implement maybe food as medicine or phytochemicals, or are you going to do a nutrition or an exercise prescription for them? And then sometimes you'll have to recognize that there might be some roadblocks or different things that inhibit somebody from progressing forward. So you have to maybe look at some behavioral and motivational coaching skills to get them past some of their roadblocks. And then category C also is you're just reassessing. You're always making sure that they're meeting those outcome goals that you presented or have put into your personalized nutrition plan. Finding a supervisor, again, the ANA provides a list, city and state. You can find somebody that maybe you've already worked with or a mentor of yours, and they can apply to become a supervisor. There are, again, supervisors here at this university that also can help you. And then if it is a mentor, again, they have to be approved by the BCNS, and typically they have to have at least 3 years of clinical experience um, to be eligible. So the clinical experience can be in a clinical practice, a community setting. It could be at the college, a home healthcare setting. It can be an internship or residency, and a combination of anything that's listed above. So you're going to start usually with your indirect hours through your program that we do here. And that's really nice because a lot of times you can get all of your indirect hours. That means you only have to get 750 of your direct. Oh, basically, it's been documented or well documented that if you go out and do your supervised practice experience before you take the exam, you actually do better on the exam. And that's because you're starting to apply and you're becoming more proficient and your understanding is greater. And I do have to tell you, the exam is very directly applicable to cases. And so that's why a lot of people do better by going out and doing their supervised practice experience first before they take the exam. If you have a supervisor, for me, I have to I had to get approved, and then I have to do a supervisor's report once you finish documenting all your hours. And then also, there is case review forms for supervisors, but usually if you're doing a electronic health record or a SOAP note, that actually replaces this case review form. And then there are checklists on the website, along with you have to do your own candidate report, and that's on the spreadsheet that I talked about earlier. And then there are also some tutorials of how to fill out the spreadsheet. And we have a program website where I put all of those documents for the CNS on that website for you, or you can go to the American Nutrition Association and download those documents also. So let's transition, but before we do that, let me ask if you have any questions about that information that I've presented thus far.
There is a question in the chat,
Yeah.
and it says, sorry if you already covered this and I missed it, but what are the general benefits of licensure?
Of what? Licensure?
Licensure, correct.
Licensure, yeah. Well, credibility. You can actually bill insurance companies, and you can actually state that you do medical nutrition therapy. And so you're going to position yourself also to make more money. And whenever you're on insurance panels, that's kind of marketing for you. You're going to get a lot more clients come to you because you are licensed, because now you are the expert, or you consider the expert because of that licensure. So those are a couple of the really main primary reasons to become licensed. People look at you as having a little bit more status and credibility. Does that answer? Is that? So those are the main reasons. Some choose not to, some choose just to stay and do health coaching and feel comfortable doing that, or maybe culinary nutrition would be a better instead of clinical nutrition. So it depends on really what you want to do. But I have to tell you, a lot of our culinary nutritionists also do clinical work, right? So especially if you're working with somebody who has a disease and you want to help them by showing them how to cook. So a lot of them become CNSs because of that too, and or become licensed. So it can really position you a little bit better. People look at you as a little bit more of the expert.
We do have another question that just came in, if we're
Yeah.
at a good pausing point here. Is there an average in terms of how long it takes people to complete these hours?
Yeah, people who are really, really gung ho, I've seen them do it within a year. And then there are some who may take up to the 5 years. So that's kind of it's one end or the other, but usually I would say 1 to 2 years is typical, more average. Questions? Advocacy, the NA really does help advocate to help get that national footprint. I do have to tell you, just because RDs have really leveraged themselves quite well in state legislature, the federal government, you can still do MNT with Medicare and Medicaid. And that's because the federal government said, no, sorry, RDs, you don't own nutrition. Nutrition is something that cannot be possessed. So that is something that also that we can bill is Medicare and Medicaid without being uh, licensed, but just being as a nutritionist and performing clinical nutrition. Now, on a state level, uh, RDs leverage themselves, but we are also leveraging ourselves and creating a national footprint also for CNSs. So you must work within the each state's uh, scope of practice. So whenever you go to your state, you need to look at the rules. And on the ANA website, they do have a map of your state, and you can click on it, and it will link you directly to the statutes and to the rules of your states. So make sure you're not stepping over those boundaries. Also, it helps us to expand our economic opportunity out there to become a licensed practitioner, which I mentioned earlier. And so we're really trying to create pathways for licensures for CNS as much as possible. So state regulation and practice of nutrition, there are 53 jurisdictions in the US. This 50 US states, and this includes DC, Guam, and Puerto Rico. CNS, we can practice some personalized nutrition counseling in 46 of those states. 20 states have licensure or certification pathway for CNSs. So we're halfway there. I think this is 21 now because she mentioned Nebraska also just added. And also Arizona, we're waiting on Arizona. A bill should be passing, I think, next year on that. And then for us also, if we will find out by the end of the year if the pause is lifted for Oregon. And so there's a few remaining states that have outdated, antiquated laws. And so that's just the problem is 30 years ago, RDs are the ones who wrote the statutes and the laws without any CNS in mind. So now we're just trying to put everything on the radar of state legislatures and updating and modernizing their statutes and rules to include CNSs. So that's the work that we're doing, and that's been ongoing. And so some states have exclusive scopes and non-exclusive scopes. So this slide shows you the different definitions. This means exclusive, most are licensed states, whereas non-exclusive means that they have certification or title protection. And there is no license or certification required to provide nutrition care. But a lot of times you won't be able to use the word MNT, but you can use clinical nutrition if that's what you want to use. So, and that's what I really counsel some students on. So these are some examples of exclusive scope, non-exclusive scope. We are trying to become exclusive in Oregon. So we're working on that. These are some advocacy tools. This is just some links for that. If you want to be involved in politics or policy, that is a one avenue also that you can work into. Any other questions?
We do have a few in the chat.
Okay.
So first one is I live in Utah, which is a state that doesn't recognize CNS. Would it still be beneficial to get CNS licensure?
Absolutely, because you can also, again, it gives you credibility and you can market yourself as an advanced nutrition, a personalized nutrition professional. And also, it you can also become licensed in another state, like Illinois or Washington. And sometimes you can get reciprocity. And that's what we did here in Oregon is we went to Washington, got our certification there, came back to Oregon and got licensed here through reciprocity. So that is another avenue also to think about if, and then Maryland also is another state that you can become licensed in and then get reciprocity. So something to think about. And then you'll have to also look at the statutes and uh, their rules and or reach out to Amy Smith. I put her website or her email address on the very first slide and reach out to her because she really knows what's happening from state to state. Any other questions?
Yeah, a couple. In Oregon, is a CNS required for licensure?
Yes.
Okay, easy one. Next
That was an
one.
easy one.
Would obtaining licensure in a separate state, would that require moving there temporarily?
No, that's a good question. No. Mm-mm.
So to me, it sounds like you can apply in that state even if you're not a resident.
Correct. Yeah. And if you want to treat patients in another state, you need to have your license or look at the rules also. You can't just treat across the border or across state lines. If you want to do telemedicine.
So I am going to go ahead and stop the recording.
Oh, wait.
Oh, okay.
Let me bring another thing. I want to see if can you see my slides now? I switched my slide deck.
No, we still have the questions up.
So I have the questions. Okay, so I'm gonna then just come back here. I'm gonna stop sharing and then I'm gonna reshare a different slide deck about our postgraduate internship, just really quickly if I can.
Yeah, and as you're working on that, we did have a follow-up question
Okay.
about the Oregon licensure. It says, does this mean we would be licensed, but it wouldn't be recognized in Oregon?
Well, no, it is recognized. Yeah, that's the beauty of it right now. But we're just on pause right now, so uh, we'll know more at the end of the year. Yeah. Does that make sense? Do I need to follow up on that? Yeah, so if you become licensed in Oregon, then you can apply to insurance panels, do MNT, and bill insurance. So, and you can do that uh, through reciprocity right now. And that's how we did it. So, but right now it's on pause. So we'll see how things kind of land in the next month or so. And we'll try to update everybody on that.
And we got a yes, thank you in the chat.
Okay, good. Thanks. So with our postgraduate internship program, you can either complete the clinical rotation or the virtual clinic experience and get also CNS supervised practice hours here. And there's just different regulations. You have to get your immunizations and to be able to also work in the clinic. So there's different regulations, substance use, state background, and then there's some HIPAA training. You also have to have your CPR training and then your OSHA health and safety standards training to be eligible for our nutrition. Oh, I forgot to change the date on that. This should be 2025. These dates have changed. A lot of times we waive the application fee, but usually it's lasts from June through December, so it's a 6-month program. And so that just kind of takes you through previous ones. I don't know why. Here we go. Okay, sorry. So through July through December. And basically, it's a 6 months of approved CNS supervised practice experience, where you're either delivering in-person nutrition services and or you're doing virtual clinic and getting your indirect hours, but we also give you some direct hours for that because we do some ground rounds on some cases. Again, it's the same as the BCNS. It's either 250 observational and 750 of direct. And this just takes you through the same thing that I took you through the other slides. So I'm just going to kind of run through this again. You have to have 200 hours in category A, B, and C, and then the remaining 200 hours could be in any of these additional categories. Our interns have to be located in Portland. So if you're in Portland, you can do this postgraduate 4 hours per week, 72 hours per term is what we will allot, or the BCNS will allot, and it has to be in those different categories. Usually the ratio is an 8-to-1 at the max. Sometimes it's more or less, but around 8 on average. And again, you can obtain 72 hours per term. And this gives you the direct experience, everything where you're doing patient care versus shadowing and or role playing and or cases. So I just wanted to kind of take you through that. And of course, you met Dr. Erlandson, who was our wonderful dean of the program. And Dulcie Childs is an RD. She does supervision in the clinic. I used to do that, but I just do the virtual clinic now. And then Kira is our wonderful faculty mentor, primarily running the culinary program. And then also Ian Rubin is a faculty member. He works with health coaching and behavioral and mental health pieces. And so this is what I went through early of how you would be eligible to work in the clinic, and you have to just go through some of the testing and trainings. And then this is the application deadline that'll come up for 2025. So I just wanted to take you through that quickly. Okay, I'll stop sharing and stop talking.
No, we want you to continue talking because we have more questions.
Okay, good. Let me get back to you.
So going back to licensure, so discussing licensure in separate states. For example, can I bill insurance for clients in Oregon if my license is in a separate state?
You would have to apply for reciprocity here in Oregon. So no, you would have to get your license here.
Okay, so in the chat it said it sounds like you need to have a license in each state in which you have clients.
That's correct. Yeah.
Okay. Thank you for the clarifications.
Yeah.
And then next one is, where can we keep up with the updates of the licensure pause?
Yes. You can reach out to me at my email. It's kqueen@nunm.edu. And then or Amy Smith, also contact Amy Smith. She's also is helping us, and she'll help keep everybody updated on that. So, and did you get Amy's email?
I'm looking that
I
up.
can grab that really quick.
Yeah, if you could. I don't know if I have direct access to that.
Okay, let me see here.
And then in the chat, as we keep going, maybe not understanding the purpose of obtaining a license in a separate state if it can't be used. Is that only if you're going to apply for reciprocity?
Yes, that's correct, because I don't use my certification in Washington. So I just did it for to be able to get my license here. Yeah, good question. Okay, let me add this to the chat.
And this is Amy Smith's
Yeah.
email you're adding. Perfect. I've emailed back and forth with her a little bit too, and she's very responsive.
She is. She'll get back to you right away, pretty much in the same day or the day after. So, and she's great. Does so much work for us CNSs, whether it's through education, through the seminars, through the symposiums, and through advocacy. So she's been a great addition to the American Nutrition Association.
Okay,
Anybody have any questions about the program or anything else I can answer?